Good morning. It is Tuesday, September 6th. I'm Jessica Lovell. Today on the Morning Medical Update.
The doctor informed me they were going to do some tests, but they thought it was probably a stroke.
You're kind of like going, is this really even possible?
A 15-year-old suffers a stroke, all while trying to stay fit and healthy. We'll meet the doctors who helped save his life. Plus, learn how common a stroke is among teens and how to spot the signs. And fresh off the Labor Day holiday, Dr. Hawkinson has the latest COVID-19 numbers. The Morning Medical Update starts right now. And thank you for joining us on Facebook, YouTube, and on Twitter right here inside the Dolph C. Simons Jr. Family Broadcast Studio. 15-year-old AJ Wishney had a stroke while working out at the gym. He's made pretty much a full recovery, but hopes his story can serve as a message for people of all ages to listen to your body. Joining us live is AJ, along with his parents, Angie and Kirk Wishney. Here in studio with me is Dr. Jeremy Peterson, endovascular neurosurgeon, and Dr. Paul Camerata. He is chair of neurosurgery, both right here at the health system. So good morning to all of you, and thanks for being with me today. Okay, well, we love getting your questions for our experts and getting those answered for you. So please ask them now on YouTube, Facebook, Twitter. You can also email us at the Medical News Network. The links are right there on your screen. Every 40 seconds, someone in the United States has a stroke. That's according to the CDC. While that statistic is shocking, even more shocking is it includes thousands of teens. But did you know that stroke in teens is usually caused by medical conditions like blood or heart disorders or drugs that increase the risk of stroke? We're also going to talk about AVMs. We're going to start with AJ's story today, and we do want to let you know this story does contain some invasive surgical video, so if you're a bit squeamish, you might want to look away for just a moment, but then come right back to us. But it was a typical day off to the gym with his older brother as usual when suddenly AJ felt something just wasn't right. He didn't ignore it, and they both sprung into action.
Well, he started in saying he wanted a tattoo, and we're like, no, you're 15. So then he said, I'd love a dog.
Angie Wishney's son, AJ, got his dog wish.
She was really good since we got her.
But in the unlikeliest of circumstances.
Good job.
It was like any day at the gym with big brother Nathan when AJ felt something wasn't right.
I was like, all right, we need to go. And then he kind of followed me and he's like, what's wrong with you? I'm like, I kind of like unintelligently said like hospital, and it sounded like close enough. He's like, okay.
So I get a call from his brother saying there was a problem, something's wrong with AJ, I need to come.
With AJ in the back seat, Angie took her son to the nearest ER and called her husband.
The doctor informed me they were going to do some tests, but they thought it was probably a stroke.
You're kind of like going, is this really even possible?
It was a stroke, and AJ needed a higher level of care. He was taken to the University of Kansas Health System, where a team of neurospecialists diagnosed AJ with AVM, arteriovenous malformation. It's a tangling of blood vessels that doctors said AJ had since birth.
There's two forms of stroke. There's the ischemic stroke, which is definitely much more common. The other side is a hemorrhagic stroke, which is what this would fall into. And that's where you have bleeding into the brain tissue itself.
Dr. Peterson and team performed a craniotomy.
So the tangle of blood vessels was small, but it was in an area that is close to his speech function.
They removed the bone off the area, dissected around the AVM, disconnected the mass of abnormal vessels, and took it out.
It's still a high-risk thing initially, but now that he's treated and the further we get him out and recovering, he'll get to the point where I probably won't have any restrictions for him.
AJ's back home now and doing well, and really looks forward to getting back to school.
Kids walk around the high school can say that someone in real life has actually seen the brain, like the inside of your head and everything like that.
Yeah, they kind of think it's cool.
And he's excited to eventually get back to the sports he loves.
Come on, G-Bug.
For now, his service dog June is his teammate, helping AJ restore his mind, body,
Can you shake? Good job.
and spirit. AJ and Mom and Dad, so good to see you this morning, and thank you for being with us. AJ, it's great to see you, and how are you feeling today?
I'm feeling pretty good.
I have to ask, are you back to those sports that you love, or are doctors maybe ordering you to hold off a little bit longer? What's the status?
I have to hold off for a little bit longer, just a little bit though.
Okay, just a little bit. I know you're counting down the days. So Kurt and Angie, so I can't imagine what you were going through. Just a nightmare, because nobody expects their 15-year-old to suffer a stroke. Just how is the family doing as a whole?
Honestly, I think we're good. I mean, seeing his recovery, and the recovery has happened so quickly, has just, really made everything okay.
Kirk, is AJ getting back to himself, the son that you know and love?
Yeah, I would say that he definitely is. It was, it's amazing. One thing that Dr. Peterson and the other doctors mentioned to us was that he'd make a really good, quick recovery. And when you saw the kind of shape that he was in, especially right before the surgery and then after the surgery, you're kind of like thinking, well, how's that going to be a quick recovery? It's amazing as the time progressed. And once he started healing, and pretty much as soon as we got home, you could tell that he was really starting to get back to himself and feeling a lot better. And obviously we're not, quite, just like you said, 100% back to be able to compete and do the same stuff that he did before, but he's definitely working hard to get there. And we're trying to take the time and stay on the right timetable that they give us, and hopefully it'll continue to get better and better each day.
Be in good patients and good caretakers. Yeah. AJ, what's it like being back to school? I'm sure kids have lots of questions.
Honestly, not really. They kind of treat me like I was before. Nobody really asks too much. I think it's because they don't know what to ask, So it hasn't been too bad.
Well, you've had quite an experience and quite a story to share, and we're glad you're doing it here this morning. We'll get back to you in just a moment. Dr. Peterson, you were called in right away when AJ came to the emergency department. Just what were his symptoms, and how did you make the diagnosis, and what were you seeing in him, and how were you able to kind of figure out what were the next steps?
Yeah, so when AJ presented, his biggest problem, like he was telling you, was his speech and not be able to produce those words like he normally would be able to. And he also had a touch of weakness on that right side. So when we use our anatomy and we localize that in the brain, that would be usually the left side that we're dealing with, because right-sided weakness and speech problems. And so at that point, you move on to imaging, and they got some CT scans and MRI imaging which showed the bleeding in the head. And around that, in a young patient that presents that way with that kind of a stroke where it's a hemorrhage in the brain, you really got to question, is it an AVM or is it a vascular malformation, we call it, that leads to that bleeding. And so then the next step was getting blood vessel imaging, which our endovascular team got special high definition pictures of the blood vessels, and then that showed the AVM. And so that's kind of where we put all of it together with his symptoms and then the imaging.
Consulting with a big team, including Dr. Paul Camerata as well. Dr. Peterson, though, you were able to wait a little bit. I mean, you're doing this assessment. I think when us regular people hear the word stroke, it's like move fast, relieve that pressure immediately. Why were you able to wait and assess and make sure that the team was assembled and you knew exactly what you were going to do?
Yeah, so that's where the two different types of stroke presentation are important, because the ischemic strokes, where you've got a blockage in the blood vessel and the brain's not getting enough blood supply, is a much more acute emergency. We got to hurry up and relieve that blockage so that the brain can get blood supply. When you've had the other kind, which is like 15% of strokes, the bleeding into the brain, that process, that damage has kind of already been created by the blood itself. And at that point, you really have to kind of stabilize the patient, reassess it, because just rushing into things isn't going to fix that bleeding that's already happened. And so you want to put a game plan together of how to treat what's going on.
And I want to put up some images here because we want to kind of tell us what you showed us. I think this was like you sent this to us on your cell phone. Tell us what we're seeing there so people understand the difference.
Yeah, so these are those high definition pictures we're getting called a cerebral angiogram. But basically we've got a catheter inside the blood vessel and putting contrast material in there that just shows the blood vessels. So what you're seeing right now is the normal picture of the blood vessels coming up through the neck into the brain and going in the middle of the brain and then on the side, on the left side.
So that's the tangling there.
Yeah, and so then you'll see on the previous one that we had, you'll see there was a tangle of blood vessels there in the center of it. And right there, kind of right in the middle. And if you go to the next one, this is after the surgery, you don't see that tangle there anymore. And so that's what we ended up disconnecting and taking out at surgery.
Dr. Camerata, what causes AVM? I don't know, some people may have never even heard. Some people think a stroke's a stroke. What is an AVM? What causes it?
Yeah, that's a good question, Jess. An AVM is a congenital malformation, a tangle of blood vessels that happens really anywhere in the body. It happens in the brain as well as the rest of the body, and it's in that part of the brain there are no capillaries. So the arteries dump directly into veins. Normally in your body, if you remember from your high school science classes, we have arteries, then smaller arteries, then capillaries, and then small veins, bigger veins, etc. And there are no capillaries in this area. So the arteries dump directly into the veins, and it causes this elongation and growing of this mass of blood vessels throughout life.
So let's talk about how they present differently. Both of you kind of weigh in on that, but what might present as an AVM and just a regular stroke? I think we all just want to know, what are the signs? What should I be looking for? And especially in my kid.
Sure. So AVMs can present like any mass in the brain. They can cause irritation in the brain. And irritation in the brain, which works on electricity, is a seizure. And so they can present with a seizure. They can present with a really bad headache. They can present with a hemorrhage, like AJ had, a bleeding episode in the brain. And they can also, sometimes if they're large enough, they can steal blood from the adjacent brain and cause symptoms from that.
So how do we know when to come see you guys? How do we know when it's something more than just a headache or more than just feeling dizzy or kind of out of it? When do we know to make the call?
Yeah. So I think, like in AJ's case, where he was having speech problems or, difficulty getting his words out. He was also having some weakness on one side more than the other side. So those types of symptoms where it's happening on one side of the body and not the other side, those are very concerning for stroke symptoms. Face weakness, trouble getting your words out, weakness on one side or the other, those are those main symptoms you really want to present to the nearest emergency room if you're having those symptoms.
Here's a video of both of you meeting with the Wishneys. When you saw AJ, did he sound and look as you had hoped? Dr. Camerata?
Yeah, so, when we first saw him, he really couldn't talk. He could barely get a word out, was having trouble with his right side. And then as the days went by, especially after surgery, he was getting better and better. So when we saw him in the clinic, we were very happy with how he was progressing.
Let's talk about, we talked about the type of strokes, but what is truly the best prevention? If somebody wasn't born with it, who's most at risk and what is the best prevention?
Yeah, so I think the things that you always want to look out for are basically blood vessel health. So no nicotine. So if you don't smoke, don't start. If you do smoke, stop. Blood pressure control. Make sure you're following with your primary care doctors to keep your blood pressure under good control. And then cholesterol levels, things like that are also risk for stroke and bleeding. Those are those main things that you can really control and watch over time to kind of help your health, even if you have one of these types of pathologies going on.
So AJ, we want people to have a better understanding of what impact this AVM stroke has had on you. And here's what you had to say when we first talked with you.
Sometimes I slur my speech, especially when I'm tired. But other than that, I still like to stay active. I've been taking my dog on walks and stuff.
And we're going to talk about that dog here in just a moment, your new BFF. So tell us a little bit about, so you came out of the speech doing well, and then how else has it changed your life?
Honestly, it hasn't really, other than just how active I am. Because I spent all my time doing sports and stuff, so that's slowed down, but I still hang out with friends as much as I can, and I can go swimming again. So I've gotten pretty back to normal for the most part.
Back to normal. And I know that's what these two guys are excited to hear about, because he's saying he shared some of these signs of stroke, and that's what you said, but how do teens experience stroke in a different way? Is there anything they should be looking at, whether either kind of stroke? Is there something we should be taking in consideration?
Well, it's unusual for teens to have strokes, period. And when they do have them, it's often something like this, a congenital malformation, an aneurysm, something like that. The types of strokes in different age groups is quite different. So it's unusual for sure. So if a teen notices anything like what AJ experienced, they should really call 911.
Is it typical then, like AJ, he's, I think when we think of stroke, you might be kind of using a layman's term, kind of out of it, but he recognizes that there's something going on. How smart was it that he looked at brother and said, there's something going on, and tried to get his words out? Mm-hmm. How imperative was that?
I mean, so that's the most imperative part of having a stroke, is that some patients, when they're having their stroke symptoms, they still have enough function that they can get communication out to let people know they're not feeling things, and that might be really early. Later, if he would have waited, he was to the point when he presented where he may not have been able to get those words out. So it's important, once you see those symptoms starting, to really notify somebody, especially if you're by yourself or you're with someone. Let them know, hey, this is different, or I'm feeling something different. That way they at least know early there's changes happening. Because if people present where they're not able to understand they're having a stroke because that part of the brain is being affected, those patients can have a harder time getting to somebody, getting care faster, things like that, because they're just not able to communicate what's going on.
Okay, can we talk about a dog now?
Please.
Please.
Absolutely.
I know, let's not talk about a stroke. Let's talk about, okay, AJ, you got to tell us about June. And is she lazy? What's she doing? Getting her beauty sleep behind you?
Yeah, she's great.
She's
so,
got to be
like,
part of this too.
Yeah, oh yeah. She knows when it's time to go to sleep and stuff. She's really good at like cuddling and stuff. But then she also has times where she really wants to play. There she is.
There she is. Okay, so let's back it up. You said you wanted a tattoo. Is this what you said? And who said no first, mom or dad?
Yeah,
Good call. Good call, mom and dad. So here comes June. He said, okay, fine, I want a dog. And she's kind of come into your life. And tell me a little bit about her and what she's meant to you in your recovery.
She's super nice, and like in case of like I'm home alone, I can just hang out with her. You know, I don't have to get stressed out being like, oh, what if something happens, you know, and make myself get anxious. She's really good.
She's helped him part of the way as well, just where he has to speak and give her commands and talk to her about things. That's kind of been working on speech a little bit, you know, throughout the summer when he was still doing a lot of therapy, and then taking her for walks and exercise. So she's encouraged him to work on things that he would need to be working on anyway, as well as the emotional support. So,
Kirk, how's the new family member doing?
Oh, she's doing really well. It's kind of funny because at first she really took a liking to AJ, which is just the most amazing thing. Even we actually took her to our veterinarian to see what he thought about her being AJ's, you know, service dog, and he was like, "Oh, she's great, go for it." And she really took a liking to AJ, took a liking to Angie, but she was a little hesitant towards myself and AJ's brothers at first. But I think she's really starting to get used to things quite a bit. So she really has been a great addition. She loves to go out, and if I walk outside, sometimes she'll follow me. She just wants to run around and play around, and she enjoys taking laps around the yard, that kind of stuff, getting exercise that way. So it's been a lot of fun having her around, that's for sure.
Well, she's camera ready. Okay, so docs, how important is that though to have an animal, just I guess maybe to calm anxiety, just to have someone there with you? Is this something common when you have somebody who's had a stroke?
Yeah, it's very common to have people have some sort of therapy dogs and therapy animals around, and it helps relieve the stress and anxiety of recovery for sure.
Dr. Peterson, have you noticed that with patients in the past?
Yeah, even on the inpatient basis, there's programs where they bring in dogs for therapy and trying to help patients that have had strokes or other neurological injuries with some of that recovery.
All right, let's check in with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Check in with our COVID numbers as we come out of this long holiday weekend. Good morning.
Yeah, hi. It was nice and relaxing.
Right.
Hopefully for most people it was. As far as active infections in the hospital, again, our numbers continue to creep down slowly. We know that the trend nationally for hospitalizations and cases is decreasing, as well as for locally based on the MARC COVID dashboard. But today in the health system, we have 16 active infections, 3 in the ICU and 2 on the ventilator, still 14 in that recovery period. Overall, we are continuing to hope that it will continue to trend down as we get into these colder months moving forward.
So what about our monkeypox numbers?
Yeah, monkeypox in the U.S., again, numbers haven't been updated since the weekend, but it's about 20,000 cases. Overall, the trends of cases around the United States continues to decrease as well. Numbers have slowly ticked up in Kansas and Missouri from where they were over the past couple weeks. But hopefully we will continue to see those decreasing cases. And of course, for those highest at risk, getting that vaccine. We know here at the hospital we have given about 140 doses of of JYNNEOS vaccine to those at-risk populations.
Okay, I think this question's come through for you before as far as monkeypox goes, but is monkeypox something you could get out in public at a gym per se, where you're, close proximity or in saunas and hot tubs and things like that? Talk us through it.
It's certainly plausible, but it's highly unlikely. Again, you are going to be doing more of that intimate skin-to-skin contact. Certainly we know in bedding or clothing, if you're sharing those, you can. It is going to be, again, it's plausible, but it's very highly unlikely. That's why we continue to endorse adequate hand hygiene, especially when you're in the gym. You have so many people in there touching different exercise equipment, weights, what have you. So just make sure not to put your hands in your eyes, your nose, your mouth, in adequate hand hygiene. I think most gyms probably have a lot of alcohol dispensers for that hand sanitizer, but also using soap and water as well.
And one more quick question back to COVID. The Kansas Health Department reports last week Kansas hit 9,000 deaths from COVID-19, including 13 children. What could those numbers indicate?
Just that we know what it is. We know that everybody in the nation, everybody in the world has been impacted. We have seen the death rates and the death numbers in the nation in general, but also here in our state. And it also should go to show everybody that, although kids are less affected and have less risk of those severe complications, they are affected. They do have complications such as death and severe disease as well. So it's important to get that immunity, that safest immunity, through vaccinations, and it's certainly coming up boosters as well.
All right. Any reporters on the line today? Well, let's get to our great community questions. As always, Juan wants to know, can stroke occur in babies? What are the most frequent causes?
So strokes can present in babies. There are a number of different reasons. Some of them could be, birth trauma. Some things can be where the child just isn't getting enough oxygen or blood supply based on interactions of the placenta with the mother and the child and that blood supply. To have the strokes like we're talking about in adults and even younger children, the mechanisms are much different. And to have somebody present with a stroke like we see at the time of birth would be unusual.
And you also said that there's some studies that show pregnant women may be at higher risk of a ruptured AVM.
Yeah, so there's some conflicting data, but there is a concern that if somebody has an AVM and they are pregnant and they kind of go into preeclampsia or times in pregnancy when your blood pressure can be very elevated, that those patients are at a higher risk of bleeding from their AVM or an aneurysm if they have them. And so if you know that you have those, it's good to be observed by your obstetrics team. They may involve the neurosurgery team to discuss what that means for observation and monitoring throughout your pregnancy.
Dr. Camerata, Pamela wants to know, she says, my sister has migraines that makes it hard to get her words to match up to what she's trying to say. Sometimes she doesn't make sense. She sees a neurologist and says it's her migraines, but how do you tell the difference between that migraine and a stroke?
That's a good question. A migraine, if she has migraine, she's undoubtedly been worked up by a neurologist, and almost all people with repeated and serious migraines will have at some point in time brain imaging, and that imaging will disclose the presence of an AVM if there were one. So I would say that she's likely already had the imaging that would verify that she does or does not have an AVM, but the symptoms can be very similar.
So Yan Liang wants to know, what are the clinical symptoms of AVM? What would that be? And second question, is it hereditary? Do the Wishneys need to have their other children seen? When would that be necessary?
So for the first part of the question, which is a good one, the signs, symptoms, the things you'll see with an AVM, number one, you may not have any symptoms ever at all. Which is common, and we're doing a lot more imaging on patients for other reasons, and we find these what we call incidentally. We just find them in people which haven't had any symptoms at all. The other symptoms are bleeding in the brain, which can cause those stroke symptoms, weakness, speech problems, those things that we discussed. The other thing are seizures. So people could have, those same symptoms, speech problems or twitching of an arm or face, weakness, things like that. And then it goes away shortly after that happens. So you get back to almost normal right away. That could be a seizure activity, and that's another reason that people present with these or why we find them. And then the second part of the question was any link to hereditary or genetics, things like that. There are a few syndromes or reasons where patients present with AVMs, especially in the brain, where it does run in the family. That is definitely not as common of a reason. And so a lot of times those patients or families will have AVMs in other parts of the body. Like we said, it's not just in the brain. You can have them in the lungs, the liver, things like that. And a lot of times those things are when multiple family members present with history of AVMs. Outside of that, it's just not common enough that you would do any screening or anything like that within the family.
Okay, but it would certainly be a concern, I think, just wondering if this could ever happen again. Could AJ have another episode?
Yeah, so that's a really good question, Jess. The AVMs, once they are completely removed, and we verify that by doing an arteriogram afterwards to make sure there's no early filling of the veins, once they're completely removed in adults, never recur. We've never known that to happen. In children, young adults, teenagers, there have been rarely reported instances of AVMs coming back, even after they are completely gone on an arteriogram, and that really has come about over the last 10 or 20 years in our recognition of this. And so for young people, we always have them come back in a delayed fashion, either a year, sometimes 3 or 4 or 5 years later, and repeat the arteriogram to make sure it's completely gone.
Good constant monitoring.
Exactly.
Jen wants to know, and this is for Angie and Kirk, and Angie, Jen wants to know when AJ got in your car, what kind of signs and symptoms were he showing? How did you stay calm is the question.
At the point that he got in my car, he was kind of limping to the right, like weakness of the right leg. His right arm wasn't working. His face was starting to droop. Speech was pretty unintelligible, but it got worse as we went. I wouldn't say I was completely calm. There was definitely urgency there, but I knew it was serious. I knew he hadn't just bit his tongue. Like, we knew we needed to get help. So the thought process was, let's just get to the closest ER and see what's going on here.
I would say that I wasn't there till later on, but in talking to his brother Nathan, who was there with him, and then also Angie and AJ, just the biggest thing was that we could tell something was up because he just couldn't communicate right. And I think that's the thing that alerted Nathan to call Angie and then get things going, which is because we could tell that AJ was trying to communicate to him something was up, but couldn't quite say it. And at that point, we just knew that was abnormal. So obviously there was something that had to be done about it.
I have a question. This is going to be the last question, and then we'll ask our COVID questions tomorrow, Dr. Hawkinson, okay? Yeah. Juan wants to know, are there any studies of stroke congenial malformations? Anything new, any studies that would be of kind of what's coming on the horizon when it comes to treatment and diagnosis?
Yeah, so currently they are running a lot of genetic studies on different vascular malformations, not just AVMs, but other ones as well, and trying to find any genetic links to why AVMs develop or get more to the source of those genetic pathways that are common in AVMs. And then hopefully the future is targeting those for some kind of treatment down the road that would either decrease a risk of rupture or development of an aneurysm with these. But those evaluations are probably in its infancy at this point of, number one, just trying to figure out what all those genetic pathways are or that have a connection before we can target treatments.
Okay, Margaret actually has the last question. I wanted to get this in because I think it's interesting. She read that people with AVMs shouldn't fly. Is that true? Is that something to be concerned about?
I have not read that, no.
Okay, good.
I would say I've never heard that, and airplanes are pressurized nowadays, and it shouldn't be a problem.
Okay, that's good to know. Have you heard anything like that?
No, and I'm a little more lax on my restrictions on things because we don't have great data out there that's comparing these restrictions on people. Like AJ, it's gone. He's going to go back to wrestling here pretty soon. I wanted to hold him out of baseball just for healing purposes from a surgery. But outside of that, it's hard to restrict people from living their life because we can't control a lot of these things.
Right.
And so to put restrictions on people without solid data, I don't think is
Any comments on that, Dr. Camerata, just about restrictions you have? Because I think you want to kind of keep people in the little bubble and keep them nice and protected, but at the same time, you got to find the balance.
There's kind of this interesting story. AJ may know of this. There was a ball player for the Seattle Mariners, John Olerud, was a first baseman, and John wore a helmet his entire career. He had an aneurysm rupture when he was in college, and because of the surgery at the time, felt that he didn't have adequate protection there on the side of his skull. So he wore a baseball helmet when he was playing in the field. He wore a baseball helmet literally every time, not just when he was at bat. Wow. It was kind of cool to see him out there and know that he had brain surgery, but we don't need to do that anymore.
You don't need to do it. He was doing what he thought he could do. Like, hey, this is the control I can take to try to protect myself. That's interesting. Yeah, well, we want to see AJ back there on the mat, healthy out there on the fields and doing his thing. I want to get to our final thoughts from our guest today. Dr. Peterson, I'll let you get us started. What should we know?
Yeah, I think the biggest thing from today is if you present with any symptoms or you have trouble with your speech, weakness one side or anything, tell somebody and tell them as quick as you can so that you can get to the nearest emergency room. We have a lot of great healthcare providers out there in our community and the state. We obviously think KU is the best at what we do, but the biggest thing is getting evaluated as fast as you can.
Dr. Camerata, final thoughts?
Yeah, I would second what Jeremy said. Just get to medical attention as quickly as possible, and if you can, get to a place with really state-of-the-art equipment. We've got a phenomenal team here of surgeons, of radiologists, of nurses, of caregivers, and we all came together to treat AJ and get him back to his usual state of health.
Oh, good. We're glad. Yeah. They look great. Wishneys, I want to go to you. And AJ, I'm going to start with you. Final thoughts, just kind of here's your moment. Tell us what you want us to know.
I don't really have anything. I mean, everything's going good. Thank you guys for being able to get me back to what I wanted to get back to with life and everything.
Okay, thank them for getting you back to health. Thank me for getting you out of class this morning.
Yeah, thank you.
Okay, okay, all right. So Kurt, just I want to ask you and Angie both. Kurt, I'll start with you. Just what should parents know? What is the cautionary tale that you want people to really walk away with today?
Man, that's a good question too. I think that just when it comes back to anything, just spend time with your kids and appreciate them and obviously know what their limitations are and know when something's up and kind of have a plan in place about what to do. But it's interesting because one thing I really agree with what Dr. Camerata was saying was that, even though like I remember hearing about John Olerud, I remember watching him play first base with that helmet on. And it's interesting to hear he didn't really need it because that's the thing with us is that even though we're keeping AJ out of wrestling right now in baseball, we're still trying to get life back to normal and try to still go about doing things. It's interesting because one of the things that the question about going up the airplane, when we were out in Colorado with his baseball team, we didn't play, but he watched. And one of the things we got to do is we took a ride up Pikes Peak just for a little bit to see what's up there. Yeah. And we didn't stay too long because we weren't sure how much it affected age, but we still did that kind of stuff just because, you still want to live life and make the most of it and try and enjoy things as best as you can. I think just once again, you have to know what the good things are and what things you should take limitations for and obviously just be aware of what your surroundings are and what you should look out for. Is the best I can say.
Yeah, great advice. Angie, I think when we spoke, I remember AJ saying he's, trying to become, and it was not too long after this happened, trying to become independent from you guys, trying to work through these things on his own. You're the mom. How did that work out for you? And, how are things going? And just your final thoughts.
Well, I've been amazed at his process of recovery because he'll go from not doing something one day and a day or two later, boom, there he's got it. And so I've tried to be there and support him and, help him out as much as I can. But when he's ready to fly, I just have to let him go. We've noticed, like with his speech, he went from unintelligible. A few days later, we could begin to understand him. And then a few weeks later, everyone could understand him again. And we saw a similar setback when he started school. He was really tired. He made it, but he was really tired the first week. And we're thinking, what do we need to do? But by his second week, he's fine. He's not sleeping when he gets home anymore. He's been able to, still be able to study and do things with friends. And so I think it's just kind of knowing his limitations and being there when he needs that support and kind of letting go a little bit whenever he doesn't need the support.
Thank you so much for sharing your story today. When I first spoke to you, you were sitting in the hospital, so it's so nice to see you all sitting there at home. Okay, give June big hugs and loves, lots of runs today, and lots of treats.
Sure will. Thank you.
Bye, guys. Thank you. Stay in touch, okay?
Okay, sounds good.
Dr. Hawkinson, final thoughts today?
Just a great story. So glad he's doing well. It's always important to keep everybody healthy, especially the young people, and keep them active and being out there and living their lives, just as we heard our surgeon colleagues talk about it. It's always so great working with them as well, and just really seeing what they do every day.
Again, we got some great questions for you today, so I'm going to hold those off to tomorrow for open mics. Thank you so much. Finally, this morning, scoring a home run with children undergoing proton therapy treatment. The Kansas City Royals have donated 2 Nintendo Switches for kids to play as they await treatment. Royals pitchers Jake Brentz and Josh Staumont delivered the game consoles and got to tour the Proton Center and see how everything works. Staumont says this is the least he can do to help kids take their mind off the treatment for a while.
As these kids go through and as people go through this, nobody chooses cancer. Nobody's actively going about this, and so having a little bit of semblance of they're a unique person going through a unique circumstance, and they have this idea of some sort of control and emotion in it, as much enjoyment as you can find in comfort.
The guys hung a bit and talked with our Cancer Center employees and posed for a few photos. So we thank them very much. Those will go a long way for those kiddos and their parents. Well, thank you so much for being with us today. Don't forget you can catch our updates anytime by logging onto Facebook, YouTube, and Twitter. We are excited to be back with you live 5 days a week. We will see you back here tomorrow for Open Mics with Dr. Stites. Go out and make it a great day.
Did someone say Star Trek? Edging closer to the medicine you see in Star Trek. I'm Dr. Steve Stites. On the next Open Mics, researchers at the University of Kansas Medical Center are now using artificial intelligence to study some kidney injuries. The study putting Kansas in the spotlight Wednesday at 8. Live long and prosper.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.